Assalamu alaikum. Hello and welcome to another episode of Care Across Cultures with me, your host Mirban Hussain. You are listening to us on Link FM 96.7. We're also available on DAB and online. Today we are talking about learning disability and palliative care. A conversation that really matters, but doesn't really happen often enough. So what is learning disability? Learning disability, I suppose in Urdu you could call it सीखने में दुश्वारी या ज़हनी मजूरी. And palliative care, the sort of big word is taskini nigadasht. But in simpler words it means जहाँ इलाज के साथ साथ दर्द, परेशानी और तकलीफ को कम किया जाता है. Basically care that focuses on comfort, relief from pain and support. In the UK, adults with learning disability die almost 20 years earlier than other people. Around 4 in 10 of these deaths could have been avoided with better care and earlier care. For many families, especially in South Asian communities, this is not just about numbers. It's about izzat, dignity, zimmedari, responsibility, and khayal, or care. Research also shows us that people with a learning disability from ethnic minority backgrounds die even younger than the 20 years I mentioned earlier, which is why palliative care focused on comfort and compassion, is so important. And just to remind you that palliative care is not about giving up. It's about doing the right thing for the people you love. As always, this is your programme too. If you have a question or you want to join the discussion, please call us on 0114 26 1818 or text us on our WhatsApp on 079 39 849 339. Before we start, here's a disclaimer. The views and opinions expressed on this programme belong to me and my guests, and not necessarily those of the organisation that we represent or of Link FM. This is Care Across Cultures, and I'm now going to introduce my guest today. I'm joined by Councillor Joanna Baker-Rogers, who is here with 2 roles today. I'm sure she wears many other hats as well. Joanna is Cabinet Member for Adult Social Care and Health at Rotherham Council. But Joanna also brings lived experience of a disability to her role. Joanna, thank you for joining us.
Thank you for inviting me. I'm delighted to be here.
Thank you so much. How was your journey here?
My journey was fine. Your directions were very easy to follow. Thank you, Madam.
That's good. I'm happy. So, Joanna, we've got a lot to go through today. Mm-hmm. So straight into questions. You're both a counsellor and someone with lived experience of disability. How do those both perspectives shape how you think about people with a learning disability?
That's a really good question to start with. I think it makes me think that everyone has the right to live the life they want to live, and it's up to other people to make reasonable adjustments to ensure that they can. I think it gives me an insight to what it must be like to have any disability at all, and I think it makes me more empathetic. It makes me think about things from someone's perspective with a disability when I think about how we shape services at the council, and I like to think that I am open to anyone's views that has a learning disability, because I really want to hear from them, because it's their views on our services that really count to ensure that we shape our services to meet their needs.
Fantastic, thank you so much. But having one disability must open you up to the same kind of thought processes for other disabilities as well.
Yes, I think it does. You know, if I'm looking at how we deliver a service or the information that we put out, I'll always be thinking about, does this need to be in an easy read format? Is it self-explanatory? Should we have audio available for information, etc.? So yeah, I think it makes me think about things from different perspectives.
Thank you so much. We don't often talk about learning disability and palliative care in the same sentence. Why do you think it's important to have this conversation now? And I just want to sort of put that into perspective. Cancer, as we know, that 1 in 2 people will have a diagnosis of some form of cancer. And some of the statistics from Hospice UK are that by 2030, people with a cancer diagnosis was going to top 4 million. It's about 2.1 million at the moment. And putting that sort of into perspective, what are your thoughts on that?
I think you're right. I think we don't often talk about learning disability and palliative care in the same sentence. There's no reason why we shouldn't. In fact, I really think we should be doing. Because everyone who very sadly is diagnosed with a life-limiting condition will have palliative care. And that palliative care needs to meet their needs. It needs to be understood by them. It needs to be explained to them so that they understand what is happening and why. And so that we can hear their voice and understand what they want.
I said I wasn't going to throw a curveball, but I will now. Palliative care.
Yeah.
What do you understand by palliative care?
Right. Palliative care is a framework of support that's needed if you're very sadly diagnosed with a life-limiting condition. There's different stages to palliative care, or different phases. So firstly, you would need the diagnosis. Then you would have a care plan written, which says how you would like to be treated, what treatments you are prepared to accept, and also what treatments you really wouldn't want. Secondly, there's the emotional and spiritual and psychological support that someone needs, because it's really important that they're able to come to terms with their diagnosis. And if we don't get that right, how are they going to come to terms with their diagnosis and live the best life they can? Because they're still entitled to actually do that. Then there's the early stage support and symptoms, and that could involve their family, their friends, their carers, etc. Then very sadly you would move on to the end of life care, followed by bereavement support for the family and friends that you have loved and left behind. And I think that all those phases, you could be in more than one at once. You could go back to a different phase. You could change what you want in your care plan, and that could inform the care that you get going forward. So I think palliative care is complex, and it can change. You know, you may decide at the start your views on pain relief. A bit further down the line, you may think, well, actually, I want more help with pain management. So I think it's a very fluid process and support.
And one of the key things that I'm picking up from that is that it's about personalised choice, isn't it? It's not that if you're in a system or with a service provider, that they are going to say, okay, you have to have this and you have to have that. It's all about you and what you want and what your needs are.
Exactly. It's the person's voice that is there, that is of paramount importance, and it's how they want to live their life. Yes, they've got this diagnosis, but they're still entitled to live the life that they want to, and they should get the support to be able to do that. I think you would want to be given information on all of the options available, and if you've got a learning disability, you may need help to actually understand that, but that's fine. Things can be explained in different ways, in simpler language. You could have a family member support you through that process. So yes, I think it's the person's views and their wishes that are of paramount importance when it comes to their palliative care.
Thank you so much. And there are lots and lots of resources out there, aren't there? I mean, I'm thinking particularly of the Victoria and Stuart booklet that they've created. I don't know if you're aware of it, but they've created this booklet specifically easy conversations with people with learning disability, and it gives you sort of pictures and diagrams and, you know, on sort of A4 sheets that someone can work with to help people understand what this actually means.
Oh, I think that's an excellent idea. I think it's something that we need to share more, we need to highlight more, we need to get this information out there so that people know this is available to them.
Yeah, thank you so much. Where do you think services don't always work with people with learning disability, especially at end of life and palliative care within cancer? Your understanding.
Right, I think the people that provide the care probably don't have a learning disability, or don't have experience of a learning disability. Maybe they don't have a family member or a friend with a learning disability. And I think it's very difficult to support someone with a learning disability when you don't have any experience of it at all. I think it's very easy to make judgments and assumptions. And I think perhaps what people who provide palliative care need to make sure is that they're informed, they have an understanding of what it's like to have a learning disability, and the adjustments they need to make when they explain to someone what is actually happening to them, what their options are and why.
Fantastic, thank you so much. If you've just joined us, you're listening to Care Across Culture with me, your host Mirban Hussain. You're listening to us on Link FM 96.7. We're also available on DAB and online. I'm joined today by Councillor Joanna Baker-Rogers, talking about learning disability and palliative care. Joanna, I want to talk a little bit about lived experience and worries. Okay, so what worries do you hear from individuals and families from your lived experience as well when they think about the future and about serious illness?
Right, I think they're worried about what's going to happen to their loved one if they're not here. You know, when you've got a child with a learning disability, I think you must think, right, they're going to be fine for now because I'm here, I understand them, I can advocate for them. But going forward, who's going to be that voice if I'm not able to be that voice, or if I'm not here? So I think that would be one of their main concerns.
Right,
I quite understand that.
I'm going to talk a little bit about, we've started some work, haven't we?
Yes.
You and I and Rotherham Hospice and the learning disability teams, in terms of how we can improve, I think, relationships and understandings. From the hospice point of view, it's about if we do get someone with a learning disability at end of life or palliative care or with cancer, so we can then support them better. Okay. In terms of, I'm just trying to understand now, in terms of the council's role, how important is this for you as in your role as, you know, adult serve, that we sort of, you know, improve things for this specific cohort of people?
Well, if I reflect on what you said about people with a learning disability live for 20 years less than the general population, I mean, I think that's quite shocking. And I think as a counsellor, I really want to do something about that to actually reduce that inequality. There's no justification for it. No. And in order to close that gap, we need to do things differently. We need to look at things from the perspective of people who have a learning disability, and their voice is paramount. Co-production in terms of services is something that I'm really strongly in favour of. We need the people that are going to access services to inform them, so that they are shaped for them and they meet their needs. You know, it isn't for me to tell someone with a learning disability what palliative care they should get. It's for them to come to us and say, right, this is what we think we need, this is what I think would help me, and it's for us to actually action that and make that happen.
There's a difficult choice that councils across the country have to make, isn't there, in this current climate? And that's resources, that's money, isn't it? It's, you know, we know that, you know, money is short. What could people with a learning disability or services that provide for them, what can they do actually to make sure that this still stays at the top of the agenda when it comes to commissioning and that kind of stuff?
That's a good question, Mabel. Personally, I think you talked earlier about the stigma around palliative care and learning disability, and I think you have to be able to have those open and honest conversations, don't you, and talk about, well, what's going to happen when mum isn't here anymore? What could happen if you know, if you're not very well?
Yeah.
What would you like? What would you like to be able to access in terms of services? So I think the more we talk about it generally every day, the easier it's going to become to talk about it. The more people's views are going to be heard, and the easier it will be to meet the needs.
That was a very succinct and very clear answer. Yeah, I love that. Thank you so much. I'm wanting to talk a little bit about your lived experience as someone with a learning disability now. Whatever you're willing to share, how has it sort of impacted on you? Because clearly, I mean, you're a counsellor and you're the cabinet member for adult social care and health at Rotherham Council, which is not just it's not a flyby role, is it?
No, I don't suppose it is. I hope not. It's
a very sort of, you know, up there at the top level, making decisions, you know, have a lot of responsibilities, lots and lots of things to think about. Yeah. So I see you, someone who's overcome their learning disability or managed it, you know, to be I suppose a functioning part of society and actually giving something back.
Yes.
No less than the fact that, you know, you're a role model for people with people with learning disability, because I'm sure that people listening to the programme will hear and they'll think, well, Joanna's.
Yeah, well, that's big. Just to be clear, I don't have a learning disability. I have a disability. I have a speech impediment.
Right, okay.
I've always had a speech impediment since I can remember being able to talk.
Right.
And that's been a few years now, Mabel.
Okay.
So I would say that growing up in the 1970s and 80s, it wasn't acceptable to have any sort of disability. Absolutely not. And I think I spent a lot of time trying to get rid of it, and that really wasn't the right approach at all. I think as I got older, I accepted it as part of me.
Yeah.
And I then embraced it. And I think that's really helped me an awful lot, because I just think, it doesn't matter if I stammer, so what? You know, people have to maybe give me a few more seconds of their attention to understand what I am saying, but I hope what I am saying is still worth hearing. So I would say it's a journey. I've come from a very medical model of disability background, but I think I've made that transition to the social model of disability, where I don't look at it as I have to make changes. It's society that has to make changes to actually accommodate me, so that I can achieve my best possible outcomes.
I really love that. So now that you've mentioned the medical model and the social model, please expand a little bit more on that. What are these two sort of models?
Right. The medical model of disability is all about saying it's your fault you've got a disability. You are a lesser person because you've got a disability, and it's up to you to make the changes to get rid of your disability, so that you are able-bodied and neurotypical.
Right.
And that's the only way to be in society.
Okay.
Whereas the social model of disability says no. Everyone has differences, and those differences are what makes our society rich. And it's up to the neurotypical and the able-bodied to make the adjustments so that you can participate in society. So that can be from accessible transport to removing social barriers, so that you do feel welcome in groups that you wish to attend. So it's a completely diametric view of what disability is, basically. But I think it's a much more accepting view. It tells you that it doesn't matter that you've got a difference. You are who you are, and you should be able to achieve still with those reasonable adjustments.
Thank you so much for sharing that, because that's so important, isn't it?
Yeah, it is.
It's changed the whole sort of onus of disability or illness, for that matter.
Yeah.
And I think it does link to cancer as well, doesn't it?
It
Because
does.
when you talk about, there are so many communities out there who are in denial with cancer. They won't talk about it, they won't mention it. I mean, even in this country 30 years ago, we wouldn't even say the word cancer, would we? It was the C word, and you said it, you used it earlier, the C word, yeah? But now it's much more accepted, but people will sort of talk about cancer. And I think it's so important to talk about cancer, because what we have now, we have amazing medication, treatments. And I talk about lung cancer quite a lot because of lived experience. And if we can diagnose your lung cancer in the first 1 or 2 stages, you have 100% chance of having it cured for up to 5 years and be cancer free. I mean, that's amazing.
Yeah, it is. It's amazing.
Yeah? Because we can catch it early. And this is why lung cancer screening, I'm an ambassador for lung cancer screening, because it saved my life, and I know that it can save your life as well, and that's really important, isn't it?
It is.
But then we've got other cancer screenings, haven't we? We've got bowel cancer screening, we've got cervical cancer screening. There's all of these. Now, I have lots of conversations with various service providers. The gap seems to be not the organisation that providing the service. The gap seems to be them people coming to the door. Yeah. Now we are coming up to a short commercial break. We will carry on this conversation after this short break. If you've just joined us, you are listening to Care Across Cultures with me, your host Mirwan Hussain. I've been talking to the wonderful and the amazing Joanna, who I'm sure we are going to become firm friends. We'll be back after this short break. Assalamu alaikum. Welcome back to Care Across Cultures with me, your host Mirwan Hussain. You're listening to us on Link FM 96.7. We're available on DAB and online. if you'd like to join the conversation, please call us on 0114 261 8181 or text us on WhatsApp 07939 849 339. We've been talking with Joanna about learning disability and about lived experience, and learnt a lot of wonderful things. I've definitely learnt so much more. I was just speaking with Joanna during the break and talking about the first job I had in this line of work was working for MenCap in Rotherham back in the early 90s, and working with people with learning disability, and it was such a humbling experience, and I learnt so much. We did change a lot of things. I'm going to go back to Joanna now. Joanna, care can feel very broken, can't it, for people and families?
It can.
How can councils, health services, hospices work better together? I think you already mentioned something earlier on about, you talked about co-production, didn't you? How can we sort of really put that together so that we can improve care?
Well, I think co-production is really important. We want to work with people with a learning disability to actually shape services that meet their needs. We want to know the kind of services they want and how those services should be able to help them. So I think our partnership working in our town is particularly strong. I do a lot of work with the hospital, with the voluntary sector, etc. And I really feel that in order for people to have better experiences, we need to have as strong a partnership working as we possibly can, because there is support that might be provided by health but could be provided by adult social care, and these areas are going to overlap, so we've got to be prepared to talk to each other as we really are in our town, I feel, so that we put the patients' interests first and we hear what they want and we shape services around them.
One of the barriers that I've come across from health inclusion groups, if you will, protected characteristics, is that some of them have had a really poor experience of services previously. What could you say to those people in terms of it's better now?
Right. Well, firstly, I'd like to say I'm very sorry if they have had poor experience of health services.
Let me just sort of clarify that as well, because this is not about the Rotherham Council itself. This is about, these are some of barriers that, if you were to Google barriers that health inclusion groups come across, this is one of those barriers that is mentioned quite. So I'm not sort of focusing on Rotherham Council itself or your role. I'm talking about it in general. What could we do to overcome that sort of hesitation of that bad experience that people may have had previously?
Right. Well, I think that's a very good question. I mean, I would like to think that moving forward that any healthcare professional wants to provide a good service, wants people to be happy with their services. And if they're not happy, they want to hear what went wrong and why, so that they can fix it, and for other people those same issues do not arise. So I would say communication is paramount. I would say that if you aren't happy with something, submit a complaint, because if a service doesn't know you aren't happy with them, they can't actually respond and change it. So please, if you aren't happy with a service, put in a complaint so that it's resolved, lessons are learned and services improved. But please don't not come forward to access their services because you've had that one bad experience. It's really important that if you are entitled to help, you get that help, because it will make your life easier.
I came across something wonderful last week. We were doing this lung cancer screening uptake session, and it was some Kashmiri women and some Yemeni women. And one of them said something I found really fascinating. She said, Auntie's Wi-Fi. In terms of that, and what she meant by that is that because we've given this session to this group of people, they will then talk to other people, and they call it the Auntie's Wi-Fi, the internet. And I thought that was such a wonderful thing. You know, and I think, you know, and also what I'm hoping from this is, the reason I'm asking you that question is that we know that some people, some patients, some communities will have had bad experiences. Okay, not the best. And we also know that many of those will not have made a complaint, like you said. And there are many reasons perhaps for that. It might be that language issues, it might be linguistic issues, it might be confidence, it might be lots and lots of issues. But I do want to sort of reiterate that if your experience has been bad, not what you wanted, please, you know, do make a complaint, and if you can't do it yourself, there is Health Watch Rotherham. There are health watches everywhere, and each organisation, especially the hospitals, you know, have is it the patient and the PALs they used to call
PALs,
it? And these are specific services within organisation that you can, and please be assured that. And I'm fond of talking about the NHS as being my NHS. I always call it my NHS. But the NHS and any service provider is really there to help you. They're not there to hinder. They're not there to make life difficult. We exist to help support you for your health issues. And that's a key message, isn't it?
It is, exactly. I mean, any service wants to do a good job. I don't believe there's any service out there that doesn't want to do a good job. I think that the more information they can get from people as to their experience of the service, whether that's good or bad, because it's also very important to talk about what has worked well for you.
Yes.
So that the service provider knows where its strengths are as well as its weaknesses.
Yes.
And the more you talk about these things in the community, to the service providers, to any organisation that has a feedback team. So yes, you know, at the hospital there'll be PALs, there's Health Watch. If you have complaints for your local council, they all have processes which you can use to actually raise those complaints and get a resolution. So I think that sharing experiences, both good and bad, is very important to how we shape services and getting people better services overall.
And don't necessarily listen to Auntie's Wi-Fi because of the bad experience that one person had, because as we know with Chinese whispers, they always sort of go the negative side, you know.
Yeah.
And they always sort of change, don't they? So that's really important. Care pathways. I'm really sort of interested in pathways to hospices, which we know, I mean, there are sort of certain pathways that exist already, which is through GPs or, and I know many hospices are sort of looking at different pathways. For someone like with a learning disability who needs palliative care, and the normal sort of pathways have not worked for them, what do you think might work for them, or what could work better for them?
Well, I think anyone with a learning disability probably has a relationship with at least one professional, and I think what they need to do is get that professional to advocate for them, and professionals need to be very open to actually doing that role. There are professional advocates out there and professional advocacy organisations, and I think it's really important that they make a connection with people with a learning disability, so that they know if there are issues which they feel unable to actually deal with themselves, that support is out there for them.
Okay. I think that's a key thing, isn't it? Because many people out there may not know that you have this extra support advocates. Yeah. Okay. I want to talk a little bit about staff now. In terms of training and confidence. We touched up upon a bit of this earlier, didn't we? Staff, and you've said it, staff want to help, but sometimes they don't feel confident. One of the reasons that they don't feel confident, they think that, they're afraid of getting it wrong.
Mm-hmm.
And then consequences, which always seem to be sort of negative in their own mind. There are things, obviously, if you've been negligible or if you've not done something, that kind of stuff, that's aside. But in general, what would you say to staff who want to help but are a little bit sort of reticent and don't feel confident?
Well, I think they need to have the confidence to go to their supervisor or line manager and say, look, I really feel that I need some more training on this. What can I access?
Yeah.
And and that training, particularly in a big organisation, should always be available. And I think it's a sign of strength, isn't it, to say that I need extra help with this. It's not a sign of weakness.
No.
So I think that the ability to reach out and ask for help in any role is crucial. And everyone should feel they can go to their manager or supervisor and say, look, I'm a bit unsure about this. Either I need to actually work with someone who can show me how it's done, or I'm going to need training of some sort.
Training of some sort.
Yeah.
And, thank you for that. Okay. So I'm going to ask you, and we'll talk a little bit more about, we mentioned communication quite a lot today.
Mm-hmm.
And I want to sort of go listening. Yeah.
Yeah.
How can services listen better? What can they do? We've mentioned bits of it, but if I came to you and said, Joanna, this is a group of people that, I am struggling to access, and I've got a sort of a meeting or something,
Mm-hmm.
How could I listen better to people with learning disabilities?
Right, well, I think there are some key things you can do. When you're talking to someone with a learning disability, I think it's really important that you take your cues from them. So I think you have to look at the pace at which they talk, look at the language they use, the length of the pauses in between sentences and information. Does that person like to make eye contact or not? Not everyone feels comfortable doing that. Do people want things written down? I think when everything's spoken, once you've said it, that sentence is gone. If you need more time to actually process that information, it would be better to see it written down clearly so that you can think about the answer and come back. Mm-hmm. I think you need to be prepared to ask questions in different ways, to phrase them differently, to maybe look at the time of day that you want to interact with someone. Some people prefer morning, some afternoon, some evening, and I think the responses you will get will be more informed if you can meet them at a time of day that suits them. So I think you need to be very flexible in your approach. You may need to have 2 or 3 meetings with someone who has a learning disability in order to get all the information you need, and that's absolutely fine. And they may need to have someone there to actually support them in that process, someone that knows them well, someone that understands them. So I really think you have to be very flexible and very inclusive in your approach.
Thank you so much for that, because there are sort of key messages in that, be led by them.
Yeah.
Yeah. I suppose, there are parallels there straight away. If somebody's first language is not English, yeah, you're not going to go and try and sort of speak to them, are you, when you don't speak their language either? No. You're going to get an interpreter, aren't you?
Yeah.
And the same thing if someone is deaf, yeah?
Yeah.
Or, you're going to get a BSL, aren't you?
Yeah.
So why would you then try and speak to someone with a learning disability without these extra support mechanisms in place?
I agree.
Yeah. Okay, thank you so much. For people who may be listening today and who may be worried, what would you like them to remember and take away?
I think you should remember that services want to provide you with a good service that you are happy with. And feedback on performance is crucial. If services are going to improve, are going to meet people's needs with a learning disability, we need to hear about the good and the bad. I think the fact that there is help out there if you are struggling with any issue, either from the council, a health provider, or the voluntary sector. And I think our approach is there's no wrong front door. If you come to the council and you need help, it doesn't matter who you contact, we will get you to someone who can help you. So I think what I'd like to say is please reach out. I would hope that our services would be reaching out to you anyway, but if there are issues that you really feel you need help with, please reach out, because we do really want to know about those issues so that we can help you.
Thank you so much. If you just joined us, you are listening to Care Across Cultures with me, your host, Mehban Hussain. I've been speaking to Joanna about learning disability, about lived experience, and about services and lots of different things. We are coming close to the end of the programme. Some things to remember. Do not suffer in silence. Don't think that just that there is no help out there. There is plenty and plenty of support. As a general rule of thumb, what I always say is your first point of call for any medical issue is your GP. Your GP is the access to everywhere else. And as Joanna said rightly, that I know how difficult it is to get an appointment with GPs, but you can always walk into any council department at reception and say, I have this issue and I need this help. And as Joanna said, that there is no wrong door. So if you get in touch with the council, we're not just talking about Rotherham Council, we're talking about all councils across the country, wherever you are. Just turn up at reception, mention your issue, and you will get help and support. And this is the most important thing. There is support out there. Don't always listen to Auntie's Wi-Fi. It may not be the most accurate and the most right response. It's a wonderful thing, Auntie's Wi-Fi, but if you want real proper information, please go to places where it's available. We are sort of coming close now, and I don't know, looking ahead now, Joanna, for a final sort of, in 5 years' time, in terms of learning disability, access, support, care, what would you hope has changed in Rotherham?
Well, I would like to hope that we've built on our firm foundations in Rotherham. I'd like to hope that anyone that has a learning disability that accesses council services says, do you know what, I've had a really good experience. I feel I've had the support I need so that I can live the life that I've wanted to. And where things have gone wrong, the council have listened, they've taken action, and they have very quickly resolved any issues that I have had. That's what I hope for the future, that we provide a quality service.
That's absolutely wonderful, and I don't want to ask any more questions. I want to leave it on that very positive note.
Thank you.
So thank you so much for joining us today, and I hope that you come back again in the future on a different programme.
I would love to, Mabam.
You've been listening to Cllr Across Culture with me, your host Mirban Hussain. This is the end of the programme. Allah Hafiz, and I'll be back with another programme next week. Next week we will be talking to a guest about crematoriums. Yes, I know it sounds a bit, but what did they say? You know, we're fond of saying in England, aren't we, in Britain, that, you know, there are two things that you can be definitely positive, you know, guaranteed: death and taxes. So we'll be talking about a little bit about what happens at crematoriums next week. Allah Hafiz, until next week.